Hi, Joe coming at you, RX Healthy Habits, and I'm sitting here with a great friend of mine and a video link. His name is Justin George, and Justin is a friend of mine. We go back a few years. Justin was an intern when he was doing his residency. So here's a guy who's got a lot of degrees, more than a thermometer. He's a PharmD. He's a doctor of pharmacy, did a residency. Kind of like one of those guys that really achieved a lot in his field. And that's why at RX Healthy Habits we have him on today, because when it comes to the healthcare field, I'm a pharmacist and I've come from the retail background, community pharmacy. Justin really has been immersed in the clinical setting. And I wanted him to share some insights into what him and I have been discussing about how we can serve our patients in a bigger way, I guess, to really gain control of their health. Because at RX Healthy Habits, we talk about, we want to teach you how to do self-health care so you don't have to rely as much on sick care. Him and I both will agree that there is a vital key role for sick care. Matter of fact, for healthcare, that's life-saving and downright miraculous. And he's going to share a little bit about his son. Without the modern marvel of medicine, many people we know wouldn't be around. So thank God for it. Mm-hmm. But also we wanted to talk a little bit today of his insights about how taking care of yourself is going to lead to a whole bunch of other things that can really change your life. So Justin, real quick, if you give us a little bit of a rundown about your background, because I think they need to know a little bit about, where you come from.
Sure. My name is Justin George. I'm a hospital pharmacist. I graduated from Albany College of Pharmacy in 2014. And after I graduated, I completed a PGY1 residency with Price Chopper Supermarkets, which is a regional supermarket chain in the Capital District area of New York, and with Albany College of Pharmacy. So I was there for a year. I worked with Joe. He'll have many stories of how he had to really shape me in the beginning.
I don't know about that.
I guess some of which we can't talk about. Unconventional teaching methods, but we got through it. I learned a lot, and afterwards I got a job later in 2015, in September 2015, at a regional hospital here in Orange County. And I was there for 6 years, even through the pandemic. And then afterwards, I decided to have a change of heart and wanted to explore more of the writing side. So I could talk about that later.
That's fantastic. So I hope you do talk about that, because you're transitioning out to a field of being an author, which I think is great. And I've read one of his books so far, and I can't wait till the one he's going to talk about coming up too. So, Justin, let's just jump right into it. I think one of the things I want to ask you is, with all your training, almost 7 years, I believe, of college with your residency, I want to ask you, for our audience, how much did you really get taught or learn about maybe really getting folks centered on self-health care or taking care of themselves to mitigate, prevent, reduce disease state or illness?
So I think the biggest focus in pharmacy school is more of a reactive sort of education rather than proactive, meaning that we learned about all the different medications, all the different drug classes, the disease states, and how to treat them, and what's first line, second line, third line. But in terms of recommending lifestyle modifications, diet and exercise, those were all obviously in there, but it was more of like a footnote in a presentation. It wasn't really the central focus of, we should have these patients try and lose weight and get their diet under control before jumping into medications. I guess the assumption is that most people who will come into a pharmacy are already very sick anyway. So, it's that to me that's how I think most healthcare education is, unfortunately.
So you're saying that there's more of a reactive role that versus a proactive role, and maybe difficult for them to measure outcomes, but you're right. It would not be like, look, I'm going to give you 30, 60 days. We're going to monitor you. And then if you don't get your weight down even 10 to 15%, we're going to have to put you on this medication. I think there's not that there for some of the patients. But yeah, you're right. It's a reactive thing. So let me ask you another question, though. Now, you were in a setting, clinical setting, and you saw a lot of things, very ill people. Can you share a little bit of some stories about some of the patients that you saw that maybe if they had done a little bit better job of taking care of themselves, they wouldn't be in the situations they're in, because obviously you've, in your setting, you must see some amazing things. So if you
Oh
share
yeah.
some.
Yeah, so before COVID hit, so when I was, a couple of years in, we used to have a recurrent patient. I mean, we had a lot of frequent flyers at the hospital. One of which was a girl. She was in her early 20s, a type 1 diabetic, and had been for many years since she was a child. And she was just not very well controlled. I mean, she even had an insulin pump. And I remember one time we had pharmacist had to go up there to refill her pump with the hospital supply of insulin. So he goes up there. The patient would always come in with crazy sugar levels. I think in this instance, she had a sugar of like 1200, which is really high. If anyone who's watching, I mean, your sugar is high for a diabetic. Most people are probably thinking like 200 or 300. This was 1200, and so she comes in. Of course, she's in full DKA, which stands for diabetic ketoacidosis. Her electrolytes, her whole clinical state is completely off the charts. She got admitted to the ICU, and so she was in NPO status, meaning nothing by mouth. So usually, they want to control intake and what's coming in, and monitoring fluids and what the patient is eating, so that way they can get the sugar under control. So he goes up there, and the whole family's in the room, and they're eating like chicken. They have a KFC bucket of chicken. They've got the potato wedges, the mashed potatoes, mac and cheese.
Oh my gosh.
And he's just like, what is this, And it's so sad because every time she would come back, it would almost be like she had like another amputation. The one time she came back, she had lost part of her leg. The second time, and I think the final time I saw her, she had I think she lost like part of her arm too. I mean, it's just so sad. I mean, to early 20s and having multiple amputations, and it's just, it's the quality of life and the challenges that she must have been facing. I think about her, once in a while, and think like, if somebody was there, if it wasn't for her parents or some sort of professional that could have worked with her on a one-to-one basis and helped to get better and focus on a healthier mindset, then perhaps she would have had more motivation to take care of herself and not end up there.
It's almost like there's a disconnect there between some of the stuff that you're eating. You take your medicine, and you're so in tune with making sure you're taking your medicine, but then other things you put in your body you don't get. So yeah, that must have been something else. Now, share with us briefly too about some of the stories of some of the COVID, because you really went through hell there at the hospital. Mm-hmm. Share a little bit about that, because I think sometimes people don't realize that their biggest weapon against COVID was not necessarily getting all the vaccines and the masks. It was something else. So if you could share on that, it'd be great.
Yeah. So, I was looking at, and one of the biggest risk factors for severe COVID is obesity and being overweight, along with all the other comorbidities like being a diabetic, having cardiovascular disease. But when you have a country where 74% of our population in the United States is overweight, and I think 46% are obese, I mean, we've had over 1 million deaths from COVID alone in the United States. I mean, it's insane. And all the monoclonal antibodies, all the cocktails that we have for mild to moderate disease to prevent severe disease, all have obesity as one of the criteria for qualifying to get it. And a lot of the vented patients, the very severe ones in the beginning of during the first wave, were almost always had like 2 or 3 comorbidities, and being overweight and obese was unfortunately one of them.
Wow, you must have saw some really gruesome things there, and it's got. My wife and I are talking about it as health coaches with what we do at RxHealthyHabits. Feel like, boy, can we just get across this? And I think some people heeded that, and they made some changes. But it's so important that people realize that in the future, if something else strikes, whether it be COVID or something else, if you're closer to normal body weight, you're going to have a better chance of fighting than if you're not. And that's what it's all about. So now let me ask you another question. This question is about you as a healthcare professional. what can we do, you in the clinical setting, me in the retail setting, what can we do to really drive this point home? Or is there anything we can do? I mean, I don't want to be cynical, but is there anything we can do? Is it something that maybe is not even in that scope? But if there is, what can we do? And maybe you can share a little bit of insight on your role and how you see that your role being, or maybe not. So I just thought, just roll with it.
Yeah, so I was looking last night and I found an article that was published in The Atlantic, which is a newspaper. It's from March 2016, but even then it said that only 3% of Americans live a quote unquote healthy lifestyle. And I think that's a huge opportunity for, people as healthcare professionals to have that conversation with a patient. But the problem, I think, is that we're so bombarded with all the responsibilities that we have to do. I mean, you're working in the retail community setting. You've got flu shots, you've got COVID shots and boosters, along with all the prescriptions that you got to do. And you've got a district manager who's, breathing down your neck about hitting your metrics. And in the hospital field, it's the same thing. You've got so many patients to take care of. And you've got to make sure that you get those meds up to those patients in a timely fashion. And it's hard to have that conversation. And we're also so worried about legalities these days, about being sued. There was a nurse who's facing criminal charges for that medication error, I think about or something like that in Tennessee. So, there's so many things in the back of our minds that having a conversation about lifestyle modifications, it's kind of on the back burner. So what we should do is that, in healthcare, we have so many different specialties. We have cardiologists, we have oncologists, we've got people who specialize, they're midwives or they're, OBGYN. So we know when to defer to an expert when it's out of our comfort zone. We're not all internal, we're not like all specialists, and we're not, highly versed in every single thing in healthcare. And we have to know what we don't know so that we can guide our patients to where they should be. And I think that utilizing dietitians, nutritionists, and other health and wellness coaches to be able to defer our patients to, so that they can get that one-on-one care. I think that's where we have to go.
So you're saying basically then, we have to keep doing what we're doing to get them out of the weeds and to get them on a healthier path of, treating the disease states. But there's got to be a group of people over here. And you're right, nutritionists, there's a lot of dietitians out there that they can refer to. But also, I believe, and maybe you agree with us, that people have to take a very proactive role, because we're reactive. We're going to treat your disease, but you need to be proactive and get after this. And it's going to take you really going and looking. And would you agree there's plenty online for them right now, between the internet and between some of the different programs out there, podcasts?
Oh, yeah, so much material.
The answers out there right now, Justin, are everywhere. Mm-hmm. But you got to be willing to seek it out, and you got to realize that just as important as you monitoring your blood glucose, just as important as you take your blood pressure medications, it's a prescription for you to get on a healthier path. You have to actually take vow of every day. A cleaner diet, but also your 30 to 40 minute walk, whatever you're doing. That's just as prescriptive and just as important for you to long term get healthy. So I think most people, we use this phrase at Rx Healthy Habits, when the student is ready, the teacher will appear. But people got to be ready to make that lifestyle change. And you've tried to make that point when you're in the clinical setting, and some hear it, some don't, and it's just something I guess we can keep talking about. But I want to end with this. I want to ask you one more question, and that is, where do you see this going? You and I, well, you're a lot younger man than I am, but where do you see it going with healthcare? How are we going to take the challenge of the increased costs for some of these chronic disease states, especially the big three? What do you think is going to change there? And then we're going to move on to the last question, which is about your book. So tell me a little bit about where you see it going.
I think, in the last few years, we've seen a record number of healthcare workers leave the profession. And many people, especially nurses, have either gone into travel nursing or leaving, the altogether. I've known personally some nurses who aren't even working bedside anymore. And I think what's going to happen over the next couple of years, especially in the next 5 to 10 years, there's going to be a huge uh, brain drain in healthcare. You've got very experienced people are leaving or retiring, and the people that are left are very inexperienced, and they don't have the mentors there in order to teach them what they need to know. But what overall is that healthcare is going to suffer, and our quality is going to go down, and our ability to provide adequate care is going to go down. And in conjunction with that, you have patients who are sicker. They're more critical now because many people didn't follow up during the pandemic and now trying to catch up. But now doctors and offices are so behind, they're not getting the care that they need. And I think what's going to happen is insurance companies, particularly health insurance companies, are going to pick up on this. And I wouldn't be surprised to see a situation in maybe 5 years where health premiums are higher for people with a BMI over 25. Or if you're a smoker, they're going to say, listen, if you're not going to quit smoking, you're going to have to pay more of a premium because we know that you're going to cost us more money. And we have a limited amount of healthcare dollars that we have to utilize for patients that need it, and they're going to decide that, well, you're making this choice, and well, pay up.
Well, I think go ahead. I'm sorry. Go ahead.
Oh yeah, it's kind of similar to we've had this massive hurricane that just hit Florida, right? Hurricane Ian, and it's making its way through the Carolinas and up the coast. Flood insurance is something that people along the coast have dealt with for many years, and as sea levels rise, you're going to see premiums keep going up and up to the point where living by the coast is just not going to be feasible for many people unless you're Elon Musk or Jeff Bezos or something. And I think the same thing is going to happen with healthcare, that people living a lifestyle that's not sustainable, they're going to have to keep paying more and more because the cost of care is going to be high.
So overall, and I think this is one of the things we try to get across at RX Healthy Habits is, as a country, we need to move that number of obesity is 70% to 75%. Overweight 75% down, but also obesity is a big one, from 43 to 45% down, because it's going to have a drastic impact on healthcare, and steps are going to be taken, which maybe a lot of people aren't going to like. So, all right. So really appreciate you sharing some of those insights as a healthcare professional in the front lines there of every day seeing some stuff, and hopefully people can gain from the fact here some insights from this, and the fact that our job, again, is more reactive. Your job is to be proactive, to take care of your health. And we hope some of the content here in RX Healthy Habits can help you on our website and our blogs. But Justin, real quick, we got to hear about your books and some of the things you're doing. And I'm going to put all this in the reference in the description so people can find it. But go ahead and share a little bit about that.
Yeah, sure. So in November 2021, my wife and I both quit our jobs. So she was a speech therapist working in a preschool, and I was, a hospital pharmacist at our local community hospital. And, we both were burned out. Our son has had 2 heart surgeries, and, after all of that and going through his recovery and, knock on wood, he's good now. He should be good for the rest of his life. But it took a huge mental and spiritual. Just had a conversation. We're like, we're not happy. We want to, figure out what we want to do in life. And we've always loved to write. We love to read books, and our kids love to read books. And we're like, you know what, let's just start a publishing company. So we took some time off in December of 2021. We went all the way from New York down to Florida and back. We spent some time at Universal. The kids loved it. We were in the Carolinas. I mean, it was such a wonderful trip. And then when we came back, we started LA Publishing. Got a little bookmark here. So it says "Write Free or Die," which is actually a reference to Anthony Bourdain, one of my heroes. Don't worry, you're a hero too, Joe. But Anthony Bourdain. So his chef uniform had this logo on it, and it said "Cook Free or Die." So we kind of repurposed it.
Awesome.
But
I want one of those. You got to send me one of those. I want one of those for a bookmark. I got to have one of those.
Send me your mailing address. I'll send you a couple. But it's kind of we wanted to focus on, you know, something we wanted to do. I mean, our whole lives were always, you know, you're in school, you're trying to, you know, get through school so that you can get a good job and, you know, do what society, you know, tells you to do. And then eventually you go through something tough in life and you're just like, you know, why am I doing this? And, you know, so it was a good wake up call. And I think the pandemic did that to a lot of people.
Yeah.
And anyway, so I published Glimpse of Color, which is a romance short story in January 2021. And then in April 2022, a couple of months ago, my wife wrote a children's book called Munju's Carol of Christmas, which is about Indian Christmas traditions. And we have a poetry collection, The Head in the Sky.
Yeah, I've read that one, and I've been using that in the morning for a quick read. Fantastic. And it's really, I like the wide range. But what I learned a long time ago is that people that have suffered a lot, have gone through some challenges in life, usually have some wisdom. And I think that came through in the book, in some of the short stories and some of the, I love the thing about your uncle, that story about that. That was great. But some of your other poems about some of the vets and some of the things they went through. So it's real, and it's about life, and it's about experiences, and about how we all go through things, but it's not so much about what we go through so much specifically, it's about how we come out the other side. And I think you and Ashley have a joyful heart, a thankful heart. And I think what you're doing is fantastic. I mean, you did a lot of great things, or continue to do great things in the pharmacy world, and to help and heal people. But I think this is another healing. So you should be very proud of that. I'm proud of it. So, and I do want to, I will send you an envelope so I can get one of those things. I want that. So anyway, just in closing, really appreciate you coming on board. And folks, for those who don't know about RX Healthy Habits, go to our website, RxHealthyHabits.com. We have in there a lot of videos. We have over 100 videos now. I think we're up to 120 and climbing. We're on TikTok. We're on Instagram. We're on Facebook groups. We're on Facebook business page. So we have our own YouTube channel, all dedicated to one thing, and that is to give you some tips on how to live a healthier habit life that we've learned. We're not experts. We don't have it all together. We don't know everything, but all we do is we like to share what's worked for us, because we hope it serves you well. And that's what we're all about. We're nothing more. When somebody says, look, I really need to gain control of my health, I really need to get to normal weight, that's where we can help you. And that's when, you know, we can put you on a path and get you there. So, Justin, again, I thank you so much for being with us. And I hope we can get you down the road to do another interview. And I hope that you send me all your information so we can put in the description. People can find your books. They can find out, you know, where to get that on Amazon. And also when your next book comes out, just in closing, tell us about that one quick. That's a great one.
My next book that I'm working on is called Shades of Resilience, and it's a memoir. It starts in January of 2018, when we knew that our son was going to be having some issues with congenital heart disease and heart defects. And then it goes through his first heart surgery in 2019, through the pandemic in 2020, and then in 2021 he had his second heart surgery, and that's pretty much where it will end. So it's been very therapeutic for me to write in detail about all the hardships we experienced, and I hope that people reading it will take something from it. And I think what it comes down to is just having a positive mindset, which is a lot harder to do than it is to say. But I think, you know, with what you're doing with RX Healthy Habits, it's all about, and whether that's, you know, trying to get through a very difficult time in your life, or just trying to get your health in control. I think it all comes down to thinking positively, and reaffirm that, you know, mindset every single day, every single morning, and it'll allow you to get through it.
Well, we appreciate you. And I know in the book too, you said you did some insights there about what you went through with dealing with the COVID epidemic at the hospital. So I think it's going to be a great read. I can't wait. I hope I could be on one of your automatic lists that you just ship it to me and charge me, but maybe you can talk about that another time. Anyway, listen, pleasure being with you, my man, and proud of you and Ashley. And thank you so much for taking the time for our folks there in RX Healthy Habits. And until next interview.
All right. Thanks for having me, Joe.
All right, buddy. Have a good one.
You too.